Purpose and disclaimer. This learning module is for nurses, student nurses, patients, and family members who are involved in the hospice and palliative care. The information presented should be used as a reference tool, with the understanding that knowledge and therapies can change over time. The information provided should not be used for diagnostic or treatment purposes. Please consult a healthcare provider for all your medical needs and concerns. General principles of hospice and palliative care. Over the next few minutes, we'll take a brief overview of palliative care and hospice care. We'll look at the similarities and differences between palliative and hospice care. This presentation will mainly focus on hospice care. What is palliative care? Palliative care is specialized medical care for patients who have a serious disease or illness. Let's look at some of the highlights of palliative care. Anyone with a serious illness could be treated through a palliative care approach. The focus of palliative care is relieving symptoms of distress, such as pain, dyspnea, etc. One of the goals of palliative care is to improve the quality of life. For example, a tumor that is causing respiratory distress. Therapies may include radiation or chemotherapy. The goal is to help improve the quality of life through curative type treatments. Palliative care is not dependent on prognosis, and it can be received at any point during an illness. Now let's look at hospice care. Hospice is specialized care for terminally ill patients with a life expectancy of 6 months or less, given that the disease runs its normal course of progression. Just like palliative care, the focus is on comfort and improving the quality of life. One of the major differences between hospice and palliative care, with hospice, the goal of curing the patient has now changed to preparing for a comfortable death. Hospice also provides family support during the course of the illness, through the death of their loved one, and during the bereavement period through the chaplaincy and social services. Now let's look at the payer source for hospice care. Hospice services are covered under Medicare Part A, Medicaid, and most private insurances. This benefit covers a hospice team's services, medications, supplies, and equipment related to the patient's life-limiting illness. Hospice staff will work with the patient's families and insurance providers and other resources to ensure that the patient receives all the benefits available. As mentioned before, to qualify for hospice coverage, the person must be certified as terminally ill with a life expectancy of 6 months or less following the normal progression of the disease. Providing hospice care is a team effort. A collaborative team effort creates a safe and holistic environment so that the patient and their families can receive optimal care. The medical staff is made up of doctors, nurses, and aides. Social workers, chaplains, and volunteers provide much needed support to the patients and their families. Massage, music, and pet therapy provide comfort during the end-of-life process. With any end-of-life terminal disease, there are symptoms. And with those symptoms, we have therapies to treat. Let's look at some of the common symptoms that are found within the hospice patient population. Let's look at pain. Not all hospice patients experience pain, but when they do, we need to know what type of pain that they're experiencing so the right therapies can be initiated. Pain can be divided into acute or chronic. Acute can be described as sharp, intense pain lasting fewer than 6 months, whereas chronic pain lasts more than 6 months. Somatic pain can be described as a constant dull aching, gnawing type pain. Examples of somatic pain can be found in joint pain, arthritis, osteoporosis, cancer that affects the skin or bones, cuts, burns, muscle strains, etc. Visceral pain can be described as like a pressure, aching, squeezing, cramping type of pain, usually located within the trunk of the body. That includes the heart, lungs, liver, intestinal. Some of the diagnoses could be like bladder cancer, gallstones, colon cancer, etc. Neuropathic pain can be described as a burning, shooting, stabbing, numbness, tingling type of pain. It can be found in your diabetic patients, those with neurological diseases, and even those who have tumors. A common therapy to treat pain is through medication. Medications such as Tylenol, NSAIDs, gabapentin, lidocaine patch, morphine, oxycodone, all depending on what the doctor feels best to treat the pain. Providing a massage, initiating aromatherapy, applying ice or heat, playing music, and praying have all been proven effective measures in helping with pain management. Another common end-of-life symptom is constipation. It affects 50 to 78%. One therapy to treat constipation is the increase in water intake as well as dietary fiber. Daily exercise is also important. Medications such as Metamucil, Senna, Docusate also help relieve the symptoms of constipation. Another common end-of-life symptom is secretions. It occurs when the patient loses their gag reflex. It's also called the death rattle, and it's most commonly seen in the last 48 hours of life. Symptomatic secretions have been reported in 23 to 92% of the cases. Family members have reported high stress levels when their loved ones are experiencing secretion issues. Explaining secretions during the end-of-life process ahead of time will help alleviate a lot of anxiety and fears among the family members. Repositioning your patient and raising their head of the bed 45 degrees or greater can help alleviate some of the secretion sounds. Oropharyngeal, nasopharyngeal suctioning is a viable option to help clear secretions, but it's contraindicated in those who have oropharyngeal cancer, lung cancer, anemia, esophageal varices, and other conditions. Medications can be used to help treat secretions. Scopolamine, which is a transdermal patch, can be placed behind the ear. Levsin, as well as glycopyrrolate, can be taken orally. This concludes the learning module for general principles of hospice and palliative care, with the emphasis on hospice care.